Hi, my name is William Carter. I'm one of the rehabilitation medicine physicians, also known as physiatrists, that's working on the complex care unit at Retreat. As a rehab physician, we add a different perspective to the facility and into the care of the patients. Many people do not know about what a rehab physician does, and so I think it's very important for me to explain that, as well as to explain how I feel this is essential to the care of any of your loved ones who have suffered from being in the hospital a long time, have become weakened, have had issues with strokes, major wounds, brain injuries, spinal cord injuries, because all of this actually falls under the realm of rehabilitation care. And so with rehabilitation care, not only is there a physician involved, which is the main focus of the hospital or facility you're likely at currently, but also there is the focus with physical therapists, occupational therapists, and speech therapists who are working not just to keep someone from being sick, but also to try to get them to be functionally better such that they can hopefully transition eventually towards home. My role is kind of to serve as a liaison between the physicians and the medical aspect of things and the therapists. What you will find in many different facilities is that they will lack having that rehab medicine focus. And to give you certain examples, there's certain medications which would seem appropriate in the acute hospital setting, but in the rehab setting, they can actually make someone have further difficulty moving. They can cause problems with urination, problem with bowels, things that nurses would manage in the acute care setting, and it wouldn't be much of a problem. But when you're trying to transition someone towards home, it could be a much bigger issue. My specialty area within rehab medicine is the management of neurologic patients such as strokes, spinal cord injury, brain injuries, anything that's affecting the nervous system of the body. If you have somebody who has had a severe brain injury and is not yet ready to transition to a brain injury rehabilitation facility, we can serve as the transition to continued physical therapy, occupational therapy, speech therapy, as well as the medical management to prevent there from being any major complications until the body develops enough to be able to transition to the acute care rehabilitation center.